Okay, so Richard, being an oncologist who treats Dupuytrens with radiotherapy, can you tell me what it does for those nasty little Garrod spots that people get on their knuckles?
Absolutely. So, I mean, just to say that Garrod's pads is basically Dupuytren's disease of the knuckle. So it looks exactly the same if you look under a microscope. So we know that nodules on the palms and nodules on the feet, also called plantar fibromas or Ledderhose disease, can respond quite well to radiotherapy sometimes. So I normally say that for the feet, you get about a 70 to 80% response rate. For the hands, you get maybe around the same, although we don't normally look at that so carefully. For the Garrod's pads, in terms of when we treat them, we only really need to do it if they're causing a problem. So very often people do have these Garrod's pads and they're not causing them problems and they don't really need treatment. And certainly I don't advise people to have them excised surgically because often they can come back and cause problems. But if we do treat them, then it's very straightforward to do. And I normally quote a 70 to 80% response rate. And I say that just because they're the same diseases on the hands and on the feet. There isn't any direct evidence in the literature, but I think that would be reasonable to say. And what you could expect is that perhaps they would get a little smaller, perhaps they get a little less tender. I wouldn't expect them to melt away, but quite a lot of the time people can get a response, although obviously not guaranteed.
Brilliant.